Today's CASPer questions and our expert analysis and responses will help you tackle any CASPer policy question that may come your way during the CASPer test. We will cover CASPer policy answer strategies and give you expert analysis of how to answer each follow-up question. Hi, my name is Chris, and I'm an admissions associate here at BMO. Before we get started, be sure to subscribe on whatever social media channel you're watching this from now, so you don't miss any of our upcoming videos. If you would like us to help you get ready for CASPer, visit CASPerTestPrep.com to schedule your free initial consultation. As a quick tip, check out the timestamps in the description of this video to navigate to specific sections of the video that you're interested in. Here's what we're going to cover: how to structure your answers to CASPer policy questions, sample CASPer policy questions, and our expert response. By the way, we're giving away $50 Amazon gift cards every week to the best comments and questions, so comment below for a chance to win. There's this one thing that will dramatically increase your CASPer score. I'll explain in the end of the video, so keep watching to find out. Now let's get started. Policy CASPer questions and follow-up questions from this category are typically included to assess your awareness of the local and global issues facing your profession and your ability to remain objective and non-critical of all sides of an issue. Follow this general structure to answer CASPer policy questions. In your opening sentence, shortly summarize the policy to demonstrate your awareness of the policy and its context. List a couple of advantages and disadvantages of the policy. Not only will this reiterate your awareness of the problem, but it will also demonstrate your ability to stay objective, informed, and open-minded. The last part of your answer should include your personal opinion about the policy and the reasons behind your stance. If you disagree with the policy, write down a short sentence with an alternative solution to the problem. To prepare for questions in the policy category, you should become familiar with current events, hot topic social and political issues, and challenges facing the healthcare system in your town, state, province, or country. You can start by visiting websites of your provincial, state, and federal national medical associations to read about the latest policies and news. You can learn about local and global health issues by reading the newspaper, watching the news, and visiting websites of institutions like the World Health Organization. To practice answering policy questions, you can write down a list of most important and interesting policies you encounter. Write down their pros and cons and try to formulate your own informed opinion. Practice with this strategy and know how to implement it in answering different policy questions you might face in the real test. So let's go over a sample CASPer policy prompt and questions. Here's the prompt. On the heels of the recent legalization of recreational cannabis, marijuana, in Canada and several US states, debates around full decriminalization or legalization of illicit substances has been renewed in some medical, legal, and political circles. The questions are as follows. Number 1. What is your opinion on legal recreational cannabis? Number 2. What is your opinion on legalizing or decriminalizing other illicit substances, such as cocaine, heroin, or MDMA? Number 3. What do you think is the key driver of illegal drug consumption, and what can be done to address this? Take a moment to reflect on these questions. Now let's get to expert responses to these follow-up questions. As noted, recreational cannabis usage was recently legalized in Canada and several US states, and medical and prescription cannabis is legal in many US states where legal use is still criminalized. There are many valid arguments on each side of this issue. Those opposed to legal cannabis raise a number of concerns. For one, we do not have reliable field sobriety tests for THC like we do for alcohol, making driving under the influence difficult to determine. As well, While research is still limited, some recent studies have suggested that cannabis use in late childhood and early adulthood can exacerbate pre-existing mental illness. On the other hand, advocates have emphasized that greater availability of legal cannabis may make it easier for medical marijuana patients to access their medication, as there have been gaps in access for those prescribed this substance. As well, there is a lot of tax revenue to be generated from taxation on legal cannabis, and far fewer law enforcement resources would be expended on cannabis if it were equal, opening up funds for other law enforcement issues. Personally, having considered such things, I am in favor of legal recreational cannabis for those old enough to consume alcohol. Legalization will, ideally, bring in funding from tax dollars, which in turn can be used for research into both the benefits and dangers of cannabis usage, as well as public education campaigns as such research becomes available. As well, funding made available by reduced police expenditures could go into developing field sobriety testing for THC. This is important on two counts. First, we can ensure our roadways are safe with reliable sobriety testing. And second, we can ensure that those not directly under the influence are not wrongfully charged. Currently, if a person is suspected of being under the influence of THC, a mandatory urinalysis may return a positive result if the person has consumed THC any time in the last 30 days, potentially resulting in wrongful charging and conviction. As well, getting medical marijuana patients their medication more easily and effectively should be a high priority. Lastly, the charges and convictions resulting from arrests for cannabis have been historically discriminatory, with minority communities often facing harsher sentencing for even minor offenses. As such, legalization, so long as it brings widespread pardons for past offenses, can help rectify a long-standing social injustice. Moving on to follow-up question number 2. First, addressing the question requires clarification, since legalizing and decriminalizing are not the same thing. Legalizing means full and open access, usually to people above a certain age, with no illicit status for anyone, whether manufacturer, dealer, or consumer. Decriminalization often refers more specifically to users of such substances, while manufacturing and selling remain illegal. This is the model that has been used in Portugal for over a decade. Under their model, no one who is caught using such substances will be subject to arrest, but are rather encouraged to undergo treatment and rehabilitation, with support to do so from the state. For the purposes of this answer, I will focus on a model such as this one. Those opposed to drug decriminalization are concerned that it would lead to an increase in drug consumption, which can have detrimental effects not only on those who use such substances, but on society at large. After all, a significant community of drug users would likely not be a very healthy or productive society. As well, decriminalization of use may lead to increased manufacture of such drugs, which could exacerbate crime elsewhere or lead to increased violence among those who develop and export those substances. On the other hand, those who support decriminalization tend to focus on drug use as a social and mental health issue, rather than one of individual failings or shortcomings. A system based around care and rehabilitation rather than incarceration of users would eliminate the fear of arrest many undergo if they seek treatment. As well, if this were part of a national public health care system, the cost of treatment would not be prohibitive, as cost is another barrier to care experienced by many. While I personally do not have enough information to confidently support either side, I do think that Portugal itself provides an interesting and compelling example for what could be possible with decriminalization. An approach that fosters care and support has helped a great many people suffering from drug dependency, addiction, and drug use rates have not increased in the 10+ years since this policy was implemented. That said, what works in one nation is not necessarily universalizable. So, if I had the position and resources to explore this issue further, I'd want to meet with doctors, police, politicians, recovering users, and other such parties in Portugal to learn more about their system and how and why it seems to be working. I'd also put together a multidisciplinary research team to explore other efforts and drug liberalization laws to see what has and hasn't been tried. If it did turn out that Portugal's tactics could work elsewhere, then I could consider supporting decriminalization efforts. While there are surely some who use such substances to derive pleasure at a recreational level, many who abuse illicit substances do so from a place of pain, emptiness, or loss, similar to those who abuse alcohol. As we've seen in the United States, gaps in healthcare have contributed to the current opioid crisis, wherein those without insurance for specialists or complex treatments have filled that gap with narcotic painkillers. And this gap is most evident in low-income and otherwise medically underserved areas. Similarly, research has shown that excessive drug abuse and dependency often correlates with things like trauma, childhood abuse, poverty, mental illness, and other social and medical issues. While drug consumption as a whole cannot be reduced to such causes, such correlations cannot simply be ignored. We have to follow what the evidence shows. As such, I think that the key drivers of illegal drug consumption are social and medical in nature. Simply treating such drug abuse as a moral issue or an issue of individual failing or weakness and criminalizing based on that misses the root causes of such behavior. As noted above, treating drug use as an issue of mental health, such as in Portugal, and having accessible treatment and rehabilitation for all could lead to both a greater understanding of such behavior as well as more options for treatment and a decrease in overall drug addiction. Studies from multiple disciplines, including physical health, mental health, and even sociology, have turned up similar insights, suggesting that a multidisciplinary approach that reframes the narrative around drug use may be the best way to advocate for those who self-medicate because they are suffering physically, mentally, and/or socially. However, additional research is necessary to form a firm opinion. Remember, the key to a high CASPer score is to have a concrete answer strategy for each CASPer question category. This means that even though you will not know which exact questions you are going to get on your test, you will have an approach for answering any questions that may come your way. The answer strategy we covered at the beginning of this video will help you formulate an articulate, non-judgmental, and informative answer to policy prompts and follow-up questions. Check out our blog to learn more about CASPer questions and answer strategies. I've included a link in the description of this video so you can find the blog easily. If you would like us to help you get a high CASPer score, visit CASPerTestPrep.com to schedule your free initial consultation. Hopefully you enjoyed the video, so please subscribe, like, and leave a comment. If you have any questions about CASPer Policy Questions that I didn't cover in this video, let me know in the comments section and I will get back to you as soon as possible. Don't forget, we are giving away $50 Amazon gift cards every week to the best comments and questions, so comment below for a chance to win. Thanks so much for watching this video, and I'll see you next time.